Our community safe stations are located at all of our fire stations. Residents in need will have the ability to come here to access Narcan and information on treatment services. Our fire personnel will ensure that at the start of the day, they will check the supply to make sure that the supply is still there. But there's no interaction with anybody needed. We want people to feel comfortable to come in and gain access to Narcan. Our city's fire department EMS is proud to have partnered with the East Bay Community Action Program. Together with the city, the fire department, EBCAP, have been working to launch this program in our city since before the pandemic. The pandemic did put a hold on some of our plans, but I'm glad to see that we finally reached a conclusion where we can share this with the community. Without further ado, I'd like to call up on Lou Serbo to say a few words.
Good afternoon, Mayor DeSilva, EMS Director Captain John Potvin, Lieutenant Alves, and East Bay Community Action Recovery Center Director Tom Joyce. Addiction and overdose are claiming lives, destroying families, and undermining the quality of life across the state of Rhode Island. Over the last 5 years, our small state has lost more than 1,600 Rhode Islanders to overdose coming from every community. We know how much work goes into standing up such a strong program. So again, many thanks to Mayor DeSilva, Captain Potvin, Lieutenant Alves, and Tom Joyce for putting one more tool in our toolbox to fight the opiate epidemic. Thank you.
Thank you, Lou, and we appreciate the support of your organization as well. Next up, I'd like to call on Tom Joyce to say a few words. He's the Director of Recovery Support Services at East Bay Recovery Center.
Good afternoon. My name is Tommy Joyce. I'm the Director of Recovery Support Services at the East Bay Recovery Center. But I always start, most importantly, I'm a person in recovery. And as a result, my life got a whole lot better. Today's a labor of love. You know, a while back, Captain Potvin, he talked with Chief Quick on how we could set up a safe station model here in East Providence. In 2020, 384 fatalities happened in Rhode Island due to accidental overdose. 10 of those were in East Providence. So we wanted to find a creative way and a creative solution to provide real supports, real time, to the community here in East Providence. Today is the day that's happening. Today, anybody can report to any fire station in East Providence, ask for help, or their family members can come in and ask for help. And a peer recovery specialist will be there in real time to provide not just peer recovery supports, but access to treatment and resources. One thing peer recovery specialists do, we sell hope. We share ourselves with somebody in that time of crisis, and that human touch at that time of crisis makes all the difference in the world. It's been proven. So today's the day that the recovery community is available to East Providence. I always say one of the greatest gifts that I have in recovery is being available. Today I'm available to be a better husband, a better father, a better employee, but also I'm available to help another human being that's out there struggling. So I'd like to thank everybody involved today. I'd like to thank the mayor for his support, Deputy Director Serbo, Linda Mahoney from BHDDH, Bob Crosley, Vice President of Behavioral Health at EBCAP, Chief Quick, Captain Potvin, and the leadership here at the fire department, because it really takes a village. We had 384 fatalities in 2020. I believe that one is a tragedy, not 384. So today, we're coming together to make a difference in the community and give the people that second chance that they need to live a long life in recovery. Thank you.
The component where we offer the ability for somebody in crisis to be able to meet with somebody from your agency to offer them some help and guidance through what's a difficult process stage in their lives is so important, and we're so grateful to have you be part of that. So thank you to East Bay Recovery Center. We really appreciate that. Next up, I'd like to call on our EMS Director, Captain John Potvin. Our EMS Director has been very busy, and part of the reason we've held off on this is because we've responded as a community to the pandemic in many different ways. It started out with testing, and then vaccine administration, and it's been thanks to the help of Lieutenant Horn, Lieutenant Alves, Chief Quick, and especially Captain Potvin. They led the effort to ensure that our community would get tested and then vaccinated so that we could all be here together without a face mask on. So I know he's been very busy. Despite that, this has been a priority to him. He's been working on it. I want to thank him, and I want to call him up. Thank you.
Good afternoon, Mayor. Thank you. I'd like to thank Mayor De Silva, Chief Quick, and everybody else in attendance today. As the Mayor stated earlier, when you have a big crowd and you're trying to recognize everyone, you don't want to forget anyone. So if I forget anybody, I apologize in advance. It's an honor to have Robert Crosley from East Bay Community Action, their Vice President of Behavioral Health, Thomas Joyce, the Director of EBCAP's Recovery Center, Deputy Director Serbo from BHDDH, the State Opioid Coordinator Linda Mahoney, and Rita Capistaro, sorry, I think I butchered it, I'm very sorry, from EBCAP, their Vice President of Family Development. I would also like to thank Rescue Lieutenant Jason Alves, East Providence Director of Communications Patricia Rezendi, as well as Danielle Escobar for their efforts to move the East Providence Safe Stations program forward despite our continued COVID response. As the Mayor said, it's been a time-consuming effort. We were actually vaccinating as we speak, so we stepped away so that we could be here today. As we well know, the opioid epidemic is a growing public health crisis that continues to sweep across our nation. Many people with a substance use disorder have limited access to recovery programs due to having limited knowledge of where to start other than an emergency room. It has been documented that the window of willingness to enter a recovery program is very small. East Providence Safe Stations is an innovative citywide program in collaboration with East Bay Community Action Program to help those struggling with addiction and substance use disorder by providing a known entry point to a recovery program. And as the Mayor said, and Mr. Joyce, that's really the brunt of today, to let people know that within their community, our 4 fire stations are a place that are judgment-free where they can get help. Fire stations make perfect centers for this program because they are open 24 hours a day, 7 days a week. They are staffed by trained EMTs and paramedics, and they are geographically located throughout our city. East Providence Safe Stations is modeled on programs initially established in Nashua and Manchester, New Hampshire, and locally in our neighboring city of Providence. And as was stated earlier, several other communities have now come on board. It is the goal of the East Providence Safe Stations program to provide help for those struggling with substance use disorders when they are ready, and to provide that care in a caring and compassionate setting. We know that sometimes asking for help is the bravest move a person can make, and we want them to know that they do not have to do that alone. In the fight against the opioid addiction, we are also proud to announce 2 additional programs geared at reducing the number of fatal opioid overdoses. The first is the East Providence Grab and No Naloxone program. Each of the 4 East Providence fire stations are also sites for Grab and No Naloxone. Grab and No Naloxone provides the ability for those in need to have access to naloxone 24 hours a day without any barriers. As the Mayor said, each of our 4 fire stations have a box right on the front of the building where anybody can walk up and take a dose of Narcan for their use. Each kit also provides information for a person to gain knowledge, hence the Grab and No, for knowledge on how to administer naloxone and how to connect with a recovery coach. The second is a naloxone leave behind program. If our EMS service encounters a patient whom has a suspected opioid overdose or use concern, we will leave a naloxone kit and related resource material at their home or on their possession. It is the goal of these programs to increase access to naloxone in an effort to reduce the number of patients who suffer from fatal opioid overdoses. Providing support to patients with substance use disorders is a high priority for the City of East Providence and the East Providence Fire Department, and we want our residents to know they are not alone. Thank you.
Well, that concludes the presentation. If there's any questions from the media, we'd be happy to try to answer them. If not, I I just want to again reemphasize how grateful we are to all of our partners. This is a community effort. We're not doing it alone. We're doing it as a team. I see that Robin Covington's here. I didn't see you earlier, Robin. Nice to see you. She's also EBCAP and HES. Working together as a team, we're putting our residents first. We're letting them know that we care. If you have a substance use issue or problem and you need resources, it's right here. You can do it anonymously. You come to the you'll see the Narcan box that was put together by our fire personnel. And in that box is naloxone and information where you can get help and where you can get resources. So we are grateful to the media and to all of you to help us spread the word, let our community know this is in existence so that people can take advantage of it. Thank you so much. Thank you.
I do have one question actually.
Mayor?
Not sure who'd be able to answer it, but people who are maybe experiencing an overdose or their family member is and they're worried about maybe contacting EMS services for fear of police or just some sort of repercussion. I remember at URI when you were calling a substance-related issue, police when you respond, that made a lot of students come forward a lot more readily.
There's a state law that it's a good Samaritan law. So if you report somebody in crisis who's having an overdose issue, there's no criminal liability that will be enforced, and our officers will not enforce any type of drug-related laws relating to that particular incident. So they're safe from that. We want people to feel comfortable to call 911. Sometimes it may be one of our officers who may be closer, and they're going to be the first ones to arrive at the scene because they may be right around the block, and they also carry naloxone. So it's an opportunity for us to get them the treatment as quickly as possible. And so we urge people not to be afraid to contact the police because there will be no legal ramifications or repercussions if you do.
This is just another step moving away from the punitive approach of dealing with addiction and...
Absolutely. Yeah. I mean, I think what we're looking to do is let people feel comfortable enough to know that if you find a relative, a friend, or yourself in a crisis situation, that you can reach out to 911 to get service to your house, or pull up here and grab, if you're close enough, grab a naloxone, or even if you feel that, you know, hey, I have a relative who has an issue, or me, myself, I have an issue with substance use, but I would really feel more comfortable if I had this in my household. You know, maybe I come by here, pick it up, bring it home. Now it's in my household. I let my family know what this is for. You know, nobody wants to go into overdose crisis stage, but you know, if it's your family member, if it's your relative, and they're in that situation, you're going to try to do everything you can to bring them out of that crisis situation, and we're here to provide that for them. So,
Thank you.
thank you.